Good morning. I, Dr. Varsha Uttarwar and Dr. Mohit Gunwal, on behalf of Department of Conservative Dentistry and Endodontics, Nagpur, welcome you to the 22nd day of the E-Link Fest 2020. As you are aware, we are having one lecture each day for the entire month of July, and we hope you take advantage of this varied arena of topics being broadcast every day. Today, we have with us a young, dynamic speaker, Dr. Atif Nathani, who will be speaking on the very important topic, rubber dam isolation. We welcome you, Dr. Atif. We would also like to welcome our distinguished moderator for today's session, Dr. Mamta Kaushik ma'am. A warm welcome to all the participants who have joined us from different parts of the country for this session. A request to everybody to please switch off their mics and videos so as to ensure a smooth running of the session. We are going live on Facebook. Any queries can be put up on the Facebook page Endocons VSPM Nagpur. So please take advantage of it. I would now like to take the privilege of introducing our moderator for today, Dr. Mamta Kaushik. Madam is the Professor and Head, Department of Conservative Dentistry and Endodontics in the Army College of Dental Sciences, Secunderabad. She has completed her graduation and post-graduation from Government Dental College, Ahmedabad. An active researcher with numerous national and international publications to her credit, is also a peer reviewer for 3 prestigious journals, academic editor for British Journal of Medicine and Medical Research. She is the founder editor for the association newsletter, Pins and Posts, and administrator for the National Clinical Registry for Root Canal Anatomy. Ma'am is the editor-in-chief for the Journal of Army College of Dental Sciences. She is also the recipient of the IACD Award of Academic Excellence 2018. We welcome you, ma'am. A request now to Dr. Mamta Kaushik to introduce our speaker for today, Dr. Atif Nathani. Over to you, ma'am.
Thank you, Dr. Varsha. Thank you very much. A very good morning to all of you across the nation. Hope you're all doing well and keeping your immunity boosted up. Can you hear me? Dr. Varsha? Can I continue? Okay. Very good morning to all of you once again. At the outset, I would like to congratulate Dr. Pratima ma'am and her entire team for organizing this series of very successful webinars. Coming to today's presentation, I was very happy that I am chairing this session particularly. Because can you imagine working without gloves? You know, till the early 1900s, there was no usage of gloves even in medicine, and dentistry came much later. And when it did get introduced, people didn't want to use them. People said our tactile sensations are lost, we don't want to use gloves. However, the rubber dam story is slightly different. People didn't oppose it. Nobody said this is too bad or something, but people still don't use it. So all the more because of the current scenario, there's resurgence of the rubber dam. It's finally getting the recognition it deserves. And for us as endodontists, working without rubber dam should be a challenge rather than the other way around. Coming to today's speaker, Dr. Atif Nathani, he's a very young, upcoming person. I enjoyed talking to him recently. Dr. Atif is a consulting endodontist in Mumbai and a mentor at various dental academies for both students as well as clinicians who wish to learn, upgrade their knowledge and skill set. He graduated from SPTC Varda and did his post-graduation in SDK Nagpur. He has various publications in national and international journals to his credit, and he has authored a chapter of isolation in the textbook of Clinical Fixed Prosthodontists by Dr. Moise Khakiani. Now, isolation in prosthodontics, I think, is a very creditable contribution. Congratulations, Dr. Atif, for that. And he has also been awarded for excellence in conservative dentistry and endodontics at the IHP Awards 2018. Without taking much of your time, people told me moderator doesn't have to talk much, let the speaker talk. I will hand over to Dr. Nathani. All the best, doctor. The floor is yours now.
Thank you. Thank you so much, ma'am. Thank you so much for the lovely introduction. And without further ado, I would just like to start my presentation as soon as possible because I think it'll take a long time. One second, I'll just share my screen. All right, so before we start the art of isolation, I would just like to tell you one thing about the presentation for today. I haven't included any kind of reference. I haven't included any kind of references for the articles or for the books because these are something that you can always go ahead in the library and go on the Google search and find out about isolation. So I would rather want you to understand the clinical aspects and more importantly, how to do an isolation, whether it is relative or an absolute isolation. It is important for us to understand, at least in this scenario and this age. So let me start the isolation seminar. I would like you to focus on this image first. This is something that the scientists have developed. This is the picture of the observable universe that we see. I mean, where do we stand? I cannot really tell you, but this is what we see. This is the dots that you could see are the galaxies that are there in the picture. Multiple galaxies, multiple stars, thousands and billions of stars that we see. We see them that they are very close to each other. But I think we know this for a fact that they are isolated and separated far apart. And where do we stand? We are somewhere over here, somewhere in the Milky Way galaxy that we all know it's a spiral galaxy. And sometimes in a clear sky, we can observe this Milky Way galaxy. Look how amazing it looks. And it is a wonderful picture that we can see about the galaxy. Few of us would know what this thing is. This is the robotic thing, which the Voyager that you say, they had sent it in the year of, I think, 1977. It was sent by NASA. So my point being is that when it went towards a particular planet, it was programmed to take a picture of the Earth. So this was the picture of the Earth. You can see that blue dot over there. That's the picture of the Earth from the planet Saturn. And again, when it went towards the Neptune, which is the last planet in our solar system, look at that blue dot. Look at that isolated blue dot that you can see. So everything that you know, everything that you have learned, the history, people you love, the acquaintances, the friends, the friendship, everything is there in that small blue dot that you can see. How isolated we are. And when we see from the International Space Station, our Earth looks like this. And when we go towards the inside, I mean, the way we see each other is like this, a crowded place, no isolation whatsoever. So my point being over here is that isolation is something that we are not unaware of. We know what isolation means. We know what, and there's one more term that we know about it right now is quarantine. We know about all these things because of thanks to COVID-19, and we all know about isolation. So let's jump on to the next thing that I want to tell you is, even if you are Aladdin, like if I give you the privilege of being Aladdin with the lamp and the genie inside, we can ask for anything. We can ask for huge bungalows, we can ask for properties, we can ask for peace, we can ask for money. But one thing is for sure, you'll never ask for the genie to give you the skill set required for doing isolation. Even if you ask that, the genie would be like, what the hell is he talking about? So this is something which we would not talk about, and we would not do it, and we procrastinate it. We will think, next time when the patient comes, I'll do this isolation thing and whatever rubber time is required and things like that. And I know that the isolation is kind of a very dry topic for a theory point of view, but I would like you to please stay awake and not be Mr. Bean over here. The way we see is dozing off. Please try not to do that because I haven't made this preparation of the seminar, which will make you drowsy. Now let's talk about isolation when it's in the dental fraternity. What are the goals of isolation? The goals of isolation is moisture control, first of all. First of all, it's moisture control and tissue retraction. These are the two main important goals that we want from isolation, whether it is absolute isolation or relative isolation. Apart from that, what we want from isolation is an improved access and harm prevention. So we all agree that these four are the goals of isolation that we want to achieve. Now, according to me, isolation can be divided into two types. One, it can be relative isolation, and the other is absolute isolation. So I would like to tell you, I would like to relate it to married life. Like if you fight with your wife and if you're allowed to sleep in the same room, then it's like something of a relative isolation. But if you fight with your wife and if you're not allowed to stay in the same room, and if you sleep on the couch outside in the hall room, it's like absolute isolation. You are like barred from even talking or like doing anything. So this is not how it goes in dentistry. We would always want absolute isolation in dentistry, and I would like to talk about relative isolation in general first of all. So relative isolation is something which is very subjective. Something that I would like to use as a relative isolation. For example, if I want to use a suction tip, you might not be comfortable with using a suction tip. You might go ahead and use cotton rolls, or you can go ahead and use high wax suction. So this is something very subjective. We would not rely on a particular aspect that this is the perfect way to get isolation, relative isolation. And the most important part about relative isolation is that it will always contaminate your workplace. It will not give you an absolute isolation. So what is absolute isolation? Absolute isolation is something which is objective, that you will always achieve if you do it properly. And it will always be a leak-proof isolation. Even if it is leaking from somewhere or the other, I'll give you all the tips and tricks. During the presentation, you'll get to know how to block it, how to make the absolute isolation leak-proof completely. So let's go ahead and talk about relative isolation in general. So this is something like it's very easy, and you dance in your head like Mr. Bean over here. He's talking and he's dancing over here. And we all know that. Yeah, I know that relative isolation is. Yeah, I'm good at relative isolation because it deals with suction tips, absorbents, and retractors that we always use. Even if you are in the first year of dentistry, you will always get to know what all things are related to relative isolation. So let us talk about suction tips. So whenever you join over here, I would like to stop and tell you that if you are joining right now, we are talking about relative isolation over here, and we are talking about suction devices. So you can always relate and jump into the seminar from wherever you want. So this is something relative isolation. We are talking about the suction devices. Suction devices, we all know, it looks like this, and it is easy to use. It is comfortable, and the most important part about relative isolation when you're talking about suction devices, it is cheap. So you can always reuse it, and you don't think twice. But the disadvantages of suction devices are that it cannot give you any kind of retraction of the soft tissues. Like you will have to put a finger on this suction tip near to the cheek to retract it. So you'll not get a proper retraction from the suction devices. Then efficiency also depends on the power of the suction device and power of the chair, and it can always get blocked. So if it gets blocked, then you'll have to either replace it or just throw it away. This is what we talk about suction devices, and this is a high wax suction. This is a modified version of the suction device that we use. It's kind of a vacuum cleaner for the mouth, nothing else. All the advantages of suction devices are there in the high wax suction, but the disadvantage is it is too hard to bend. So you cannot bend it the way you bend your suction devices, and you cannot use it in people who have small mouth openings. So it becomes very difficult to put in this device along with the aerator, along with the other devices that we want to use during the procedure. The orientation of the bevel over here in the high wax suction is one of the important things that we would want to focus on, because what happens is if we do not orient the bevel properly, it might suck in the soft tissue. And if it does, don't panic and don't just pull it off. You just need to turn and rotate the device, or else you can ask your assistant to stop the high wax suction. These are some of the visual means, the way you can use this device. Apart from this, there is one more thing that these people have come up with. These are small holes in the mouth mirror that they have come up with. Now, I don't like it particularly because it is to be attached to the suction device outside. It gives you a kind of resistance when you're trying to retract and see at the same time in the same mirror. So I would not prefer this, but as I told you earlier, relative isolation is something very subjective. So one might like it, one might just dislike it. So this is one of the devices that you can always use. Now we're talking about relative isolation absorbance. This is something that we all know about. Cotton rolls. This is something that goes hand in hand with dentistry. And even if you're a first year student, second year student, you're starting your practice, cotton roll is something which you always use, and always use it in the way you want it. Anterior isolation, or the lower anterior, or the posterior isolation. Sometimes people would try to buy a small holder which you can see on the left side and on the right side. This is available in steel and in plastic, so you can use it. The point over here that we would want to know is that the disadvantage is that the cotton roll will only and only absorb and nothing else. It will always contaminate. It will always get displaced, because we know the tongue is a huge organ and it's a very strong organ. So if you try to put it over there near the tongue, the patient will always be uncomfortable and it will try to displace it. It will always need replacements, obviously, because it's just going to absorb the saliva and the water that is going to be there in the oral cavity. And it is limited to a retraction, or you cannot expect more retraction from a cotton roll. Another important thing that the cotton roll does is there is cotton roll burns. So when you try to retract, and if you put the cotton rolls in the upper anterior region where there is less salivation, the cotton rolls tend to adhere to the soft tissue. When it does, and if you try to remove it, there are cotton roll burns. Your patient will always step out of the clinic with some kind of a discomfort in the upper anterior region. If you don't want that to happen, there's a clinical tip to this. You always wet it with a 3-way syringe, and then you remove it easily and slowly, so that there are no cotton roll burns over there. Now, another type of absorbent that we all know is the dry angles. Dry angles, I would tell you, the concept behind dry angle is that there is the parotid duct which goes along and opens up over here. Where is this opening? This opening is near to the upper maxillary 7. It's right opposite to that. So when you are trying to obstruct this, you can use this dry angle. You can use the dry angle to obstruct the parotid duct opening, so that you get a dry feel when you're working, when you're trying to diagnose, when you're trying to take pictures. It always has an illuminating surface on the other side, which solves two purposes. If it'll give you some kind of an illumination over the buccal side, and whenever the dry angle gets wet from the inside, it will not allow that wet surface of the saliva to come and adhere to the outside. So it will always give you good isolation on the buccal side. Now next is, oh my God, this is difficult to pronounce. Just pronounce it: polytetrafluoroethylene. What this stuff is? People you might know, and some people might be like amazed, like what the hell is this talking about? This is nothing but Teflon. Teflon will always provide some kind of isolation, relative isolation. When you're doing it, we'll tell you. This is how you use it. This is how you try to protect the natural stuff in the area of workplace. You can just remove it and you can just place it, so that whenever you're doing some kind of procedure which is related to bonding procedure or etchant procedure, the natural tooth doesn't get affected. It can be used with the help of rubber dam when you're doing some kind of composite buildup or any other procedure that requires small and bit of isolation from the procedure side. You can also plug it in like this, so that the undercuts can be covered while you are making an impression. So this is again a very good alternative to get relative isolation. Another type of isolation, the retraction cord. We all know it, and somewhere or the other we might use it. This is a twisted one, knitted one, and the braided one. Different types, but the same concept, and the way you use it is the same. You have to put it in the gingival sulcus like this. Now what happens, the best part about this thing is the kind of impression that you get. See, the impression that you see is smooth impression of the margin that you're giving a lot of effort during crown preparation. and this is the extra that flows inside the retracted gingival tissue. It's fine, but if you do it, you'll get a good margin, and it will subsequently increase the success rate of the prosthesis that you are trying to give. These are various means and methods how to use it. It can be plugged inside the gingival tissue with the help of a serrated instrument or a plain instrument. It can be dipped into hemodent, which is nothing but aluminum chloride. It doesn't have epinephrine in it. So there's no point in thinking that it will coincide with the cardiovascular thing. If the patient is cardiac patient, you can always avoid it, and you can use a hemodent. You just need to dip the cord in it and just remove it and keep it on the tissue paper so that the extra aluminum chloride gets sucked in. Apart from this, if you want to get, if you want to do a cordless gingival retraction, this is the paste. This is nothing but diatomaceous clay along with aluminum chloride. You just pump it inside, wait for 2 minutes, and just flush it out. You will get the same kind of retraction, gingival retraction, when you're talking about impression. The disadvantage of this is, sorry, one second. Yeah, the disadvantage is there's a learning curve. It's a little bit time consuming. It often requires local anesthetics and could be traumatic if you don't use it properly. So these are some disadvantages that you can overcome later on. The next kind of retractor is your isolator. This is something which is which Dr. Mohit has come up with, and this will serve two purposes. Let me just show you. One, the purpose of keeping the mouth open, like the bite block, and the other purpose is to keep the tongue at a retracted place. So when you're working on the first quadrant, or if you're working on the fourth quadrant, this is a picture that you can look up to, and you can place this and you can just shift it. And if you're working on the second quadrant or the third quadrant, and you can just shift the placement of the bite block and the isolator completely. It will give you mouth opening and secures the tongue. So this is again a retractor. This is something which is again developed by Dr. Mohit Kakiani. It is a Panora view. This is something of cheek retractor that you use. I would use it, and I would suggest you to use it when you're doing some kind of diagnostic procedures in the upper anterior, lower anterior. If you want to take pictures for orthodontic purposes or documentation, you can use this. It will give you a relative isolation. Even if you're working, if you're doing a crown preparation, you can still use it. Now, this is something which I got confused initially when I thought, what is this OptraGate and OptraDam? And when I was unable to understand it, and initially when I got confused, I just read a lot about it, and started using it. So OptraGate is something which looks like this, and the OptraDam is nothing but a sheet, the dam sheet. Let us talk about the OptraGate first, what it does. OptraGate is nothing but a tissue retraction. It can be used with the help of a suction tip, which you can use, which you can see over here. And along with that, you can put cotton rolls. So it's just kind of an adjunct that you want. Sometimes what happens is the patient gets tired of opening the mouth open. And even if the patient is able to keep the mouth open, the muscles around the lip, they become fatigued. And you will not get a proper retraction. If you're using diagnostic instruments, if you want to use a hot instrument, if you want to use a cold instrument, so you might touch the soft tissues. So if you don't want that to happen, you can always use a suction tape, OptraGate, cotton rolls along with it to get the relative isolation done. This is how you use it. You can use it during impression making. You can use it during cementation of the crown, because these are procedures that do not require absolute isolation. Now, OptraGate comes in 3 sizes, which is small, regular, and the pediatric size. Small is 6 centimeters, 7 centimeters for the regular size, and the pediatric one is the 4.5 centimeters. Usually, the filtration compliant, and it will give you a very good isolation, relative isolation for your initial diagnostic purposes. Excellent over here. Now we're done with OptraGate. We'll talk about the OptraDam Plus. So what is OptraDam Plus? It's nothing but it's just a modified version of the OptraGate. It comes in the size small and regular. And if you look at closely, it has the template around it. So you don't have to punch. You will have to punch the hole, but you'll not have to mark it. It's already marked over here for you. I'll tell you the advantages and disadvantages also for the OptraDam Plus. This is how you use it. There's a small plastic thing that you need to just press it and place it inside the mouth. Along with it, there is some kind of a well which is there for the suction. So you can always suck in water and the saliva, so not the saliva, but the water, whatever procedure you are doing, you can just remove it with the help of a suction tip. Similar to rubber dam, you just have to press it in, place it, and you are done with the retraction. Now, the question that we need to ask us is, will it be stable for the posterior tooth? And what can be done to stabilize it? So I can assure you that if you're trying to do a posterior isolation with the help of OptraDam Plus, it will be a little bit difficult, but it's not impossible. So what you do is you just place 2 clamps in the posterior side and you're done with it. You're done with the isolation. You can just look at it, how beautiful it looks. It's very easy, and it can give you, as a beginner, you can use this. And for the removal, it's the same. You just stretch it and just scissor it, just cut it out. So why is it not used that much? I really can't question you. I really can't answer that question, because usually if you want to prefer isolation using a dam sheet, you would always go ahead with the absolute isolation and rubber dam isolation. So the problem is the posterior tooth isolation is better than in the traditional rubber dam way. The inner ring of the OptraDam may hurt the patient. The radiographs are difficult to take, and it cannot be used in posterior teeth without clamps. So these are the reasons why they don't use it and why we avoid using OptraDam Plus. So OptraGate and OptraDam Plus, this is given by Ivoclar, and it is nothing. It is not difficult to understand. It's very user friendly. You can go ahead. If you are a beginner, you can always start with OptraGate and OptraDam Plus to step up to the absolute isolation, which is rubber dam. Now, it is easy to use. Relative isolation in general, I'm talking about right now, because we're going to wind it up. It's easy to use, comfortable for the patient, cheap and easily available, disposable, autoclavable, available in various sizes and color. Nowadays, these people are giving you mint flavor and other flavors that are there in the suction tips and other devices, so that it becomes compliant. It's chemically inert. You can always autoclave it, and it is latex free, the relative isolation. But the disadvantage is it provides relative isolation only. No tissue retraction whatsoever. Inconvenient. It can get problematic. It can contaminate the work field. It needs replacement and may require support. So it is not just the relative isolation alone that will give you and provide you good and proper isolation. So next, let's talk about absolute isolation over here. And we all know that absolute isolation can be achieved with the help of rubber dam. It's been there for like more than 100 years right now, and we are still using it. People use it. I would recommend to use it. And at this time, when we are dealing with such kind of a situation where COVID is there, I would always want you to use it, because even if COVID was not there, there are various other diseases and infectious contaminating diseases and infectious diseases like tuberculosis or HIV or hepatitis that you need to bar yourself from, and you need to sterilize everything. So it's better to use rubber dam, not only in this era, but in general. So let's talk about rubber dam isolation. How beautiful this picture looks, like the full arch isolation. It looks, everything is set. How you can achieve it? We can and why do we achieve it? Like salivary organic film is always there. Even if you try to do any kind of restoration or relative isolation, there will be some kind of salivary organic film that will be formed on the dental structure, which has a very low surface tension. Now, this surface tension will always adhere, and it will always hamper your bonding procedures, your endodontic procedures, your vital pulse therapy procedures. So being a conservative and endodontist, you need to be aware of all these things, and you should avoid it. What is the solution for this? Rubber dam isolation. This is the best way you can isolate and give proper treatment and good quality treatment, basically. Now, the advantages of rubber dam is it will give you a clean, dry, moisture-free operating field, access and visibility of the target area, increases efficiency of the work, discourages unnecessary, this is the best thing, discourages unnecessary chatter and frequent rinsing. And right now, we don't want that to happen. It provides protection. It provides accidental instrument aspiration and control over cross-contamination. So right now, if you want to focus on anything, and the best advantage that rubber dam provides is the control over cross contamination. During the COVID times, it is always to get control over cross contamination. So it's a humble request from my side and from everyone who is aware of this thing, please start using rubber dams. The procedures and materials that are technique sensitive. So now I would like to tell you one thing, that if you're, most of the people, most of the clinicians and most of the PG students right now are using RMGICs and biodentine and the composite restorations. These materials, we would want these materials to give their best. So if we want these materials to give their best, the materials also demand something from us, and that is absolute isolation. Because if you want a good success and for longer duration, the material should stay over there and with good quality properties, whatever the properties manufacturers say that the material gives you, the material wants you to do something for them, and that is absolute isolation. So if you do this, it is very good, and you can do it with single tooth isolation, multiple tooth isolation, quadrant isolation, full arch isolation. For me, if you ask me personally, if you're doing any kind of bonding procedure or any kind of conservative endodontic procedure, pulp vital therapy, you need to go ahead and do rubber dam isolation for good quality and better treatment. Now the disadvantage, the biggest disadvantage that we know about rubber dam is there's a learning curve. Obviously, there is a learning curve. You cannot just learn anything and everything within a minute. You do not just enter into BDS and within two or 3 months you would say that I am a good dentist. There is a learning curve to it. So whatever you learn, and it has to be a gradual process. So this thing is there everywhere. It is a disadvantage for everyone, but it is a learning curve. Now, additional time is required. Again, people say that additional time is required, but I will give you tips and tricks where you can reduce your time, and later on, once you're done with it, you would hardly take 2 or 3 minutes for the entire rubber dam procedure to be done. Now, possibility of clamp displacement and fracture. This can happen to anyone. It can happen to me, it can happen to you, it can happen to a new clamp also. I will give you tips and tricks how to avoid it. Prosthesis also gets in the to the gingival tissue. Now, this is something which you can learn gradually, and you can relax and you can put the clamp properly so that there is no harm to the gingival tissue. So all the disadvantages can be overcome over a period of time. Let us understand how we can do it. Now, things that we know are there for rubber dam. These are the basic things that we'll talk about quickly. We'll understand what armamentarium that we require during the rubber dam isolation. These are the basic things that you have to have in your clinic for rubber dam isolation. So we'll talk about the sheets first. Rubber dam sheets are nothing but just sheets or latex free sheets, non-latex sheets. These are sheets which are available in 2 sizes. One is the 6-inch by 6-inch size, and the other one is a little bit smaller, which I prefer usually is the 5-inch by 5-inch size. This is something which is common. Apart from that, there are thicknesses related to the sheets. Either it is thin, medium, or heavy. These are the 3 sheets that you can use it for the regular rubber dam isolation. But along with that, manufacturers have come up with thin, medium, heavy, extra heavy, and special heavy. So it is 0.15 mm, 0.2 mm, 0.25, 0.3, and 0.35 mm respectively. Now, this is not something that we are going and diverting ourselves towards fashion industry and makeup industry. This is just a picture for you to understand what it means when we are talking about the sheet. It is glossy appearance and a matte appearance. This is also there in the sheet that you can see. There's a glossy appearance, which is to be placed towards the patient side, and there's a matte appearance, which is to be placed towards the operator side. There are various disadvantages, but this is how it works. So we are done with the sheet. Now we'll talk about the clamp. And there are various clamps. I mean, you can see for the anterior clamp, wingless clamp, winged clamps, serrated clamps, tiger clamps, Brinkler's clamps, anything you name it, and they have come up with. We'll talk about and we'll understand how the clamp is. These are the parts of the clamp. One second. I'm sorry for this. 1 minute. I'll just go back. Yeah. These are the clamps. These are the part of the clamps. There's the bow over here. The bow over here. There's the holes for. There's the prongs and the serrated clamp beaks. This is the wing. This is the notch, and you can go ahead and read it. This is how a normal clamp looks. This is a wing clamp because wingless is the same. It's just the wing that is absent over there. Now, these are the two A and 13A. How do we use it? I have written it over here. This is for the lower right side. Now, how do I decide whether it is for the lower right side? Now, you can look at it. There is the long curve over here in the beak, which is for the buccal side. So this will always go on the buccal side. And over here, there's a beak over here. This contour is for the lower left side. So you place it. If you place it and if you replace it, it will not work. So this clamp can be worked on both the sides, but it can be used in the upper left side also and in the upper right side also. So you can use it. This is what is the clamp. Now we'll talk about the sheet. Now what is this template? There's nothing is, there's no rocket science in it. Just have to place the template on to the sheet wherever you want. If you're talking about this tooth, you just have to mark it with a marker pen, and you'll get the spot over there, and you just need to punch the hole and your hole is ready. That's it. This will serve the purpose. Apart from that, the next step is the punch. Now punch can be of two types. One is this and the other one is like this. Whichever you use hardly matters. We want the punch to work. That's it. These are different types of holes, and related to the holes and the diameter of the hole, you can use it for the different types of teeth. Now the smallest hole that you can see over here can be used for the lower anteriors. This can be used for the upper anteriors, upper central and the lateral. The third hole can be used for the premolars and for the canine, and the fourth hole can be used for the molars. Sometimes the anatomy of the tooth is huge. That is when you use the last and the biggest hole. That will serve the purpose. Apart from this, we have the forceps. Now this is the normal forceps that you use. Apart from this, we have another type of forceps, the long beaked forceps. Anything can be used. All the forceps are used. But the point that you need to understand is there is a notch in the forceps that you can see over here. There's a notch over here. Here the placement matters. When you're holding the clamp, you have to hold it like this. So it will be stable when you're placing the clamp onto the tooth. So this is what is done. This is what the notch is for. Now next comes the frame. There are different kind of frames. U frame, Young's frame, Osborne Young's frame, metal frame, plastic frame, whatever frame you want, you can use it. Whichever frame you're comfortable with, you can use it. I'm just going to tell you again, go ahead with this. This is some kind of a modification which is there. This is a foldable frame. When you're taking radiographs, it can be folded because there's a hinge over here which can hold, and you don't need to remove the entire setup for the radiograph that you have to take. So you can go ahead. The advantage of this frame, odds by Nygaard frame, is that it will relieve the anterior portion and let the patient breathe properly. So you can, if you want, you can use it. It's an O frame. It depends. It's subjective. You can use any frame. Apart from that, we have the floss, the wedges, and the opal dam that we'll let you know in the next slide. Now, if you talk about the isolation, different types of isolations are there. I will tell you how to do a single step technique, a two-step technique, a three-step technique where we put the dam first, a three-step technique where we put the clamp first. And I would want you to focus on the first step because I'm going to skip all the steps which are common to all the three steps, because there's no point in explaining the same step again and again. So please focus on the first step and we'll skip these steps. So first step technique, what we want to achieve in the first step is this. This is something that you do before the patient comes. So how can we achieve this? You just put your frame onto the sheet and prepare the sheet and prepare this thing and punch the holes. Mark the holes, punch it, and keep it ready. After you are done with this, because right now we know where which tooth are we treating, so it becomes very easy for us. take your clamp, go ahead and put it inside the last hole. And these are winged clamps. So you can place the sheet along the wing. This is how you do it, and stretch the wing and hold it along the other side. This is how you prepare and keep the entire frame ready before the patient comes in. Once the patient is there, you just have to use and achieve this. Use the forceps, hold the clamp and place it towards the tooth. Once you are done with the placement of the tooth, you just need to remove that extra bit of sheet on the wing towards the tooth. This is how you do it. And this is how you place it beneath it. So now the point is you use a composite instrument or a blunt instrument. You do not use a pointed instrument because we don't want the sheet to tear off. It is a bit sensitive, but it's very easy to do it once you know it. Just press it and let the sheet go along towards the tooth. Once this is done, you just need to stretch all the holes that you have punched and press it interdentally. Place it. After you have placed it, you can use a floss to press those sheets interdentally towards the cervical area, to apically. Once you are done with that, you can just invert the dam. How to invert it? Again, you use a blunt instrument, hold the dam, press it towards the cervical area and press it inwards. This is how you invert the dam. Once the inversion is done, you place a widget onto the extreme right side where you don't want to work, but you want the dam to be stable. So you can keep it over there. And now what you have, you're done with your rubber dam isolation. It will hardly take few minutes. So to achieve this, before, and this is after. So achieve anything which is before the patient steps in will take 2 or 3 minutes. And the minute the patient is there and you want to do the entire isolation, it will take 2 to 3 minutes. Once you are done with this procedure and once you are aware of this and once you get the hang of it, you will only take 2 to 3 minutes totally to do the rubber dam isolation in single step. So this is how you do the first step, the single step technique. It is quick and very easy. And usually it can be managed with the help of no one. Single-handedly you can manage it because you have prepared everything previously only. Now we are done with the first step technique, one step technique. Now we are going ahead and talking about the two-step technique. So why do we talk about the two-step technique? Is because sometimes we need a wingless clamp. What is a wingless clamp? It's like this. You can see and observe it. Right side is the wing clamp. Left side I've removed it to make it look like a wingless clamp. Nothing important to know, but the only thing is that it will not hold your rubber dam sheet. So that is why you need two steps. So once you are done with this, you just hold the sheet like this, remove the sheet. Over here, there is a difference. This clamp will not be able to hold the sheet like this. So the next part is you hold the clamp with the help of a forceps and place it like this without the sheet at its place. Once it is done, you press the sheet inside the tooth and place the sheet properly. Once you are done with it, you can apply the frame. You can use a floss. All the steps that we have seen in the single step technique, you need to use the floss. You need to do the dam inversion. You can use a widget or you can use a clamp to hold the other side of the dam sheet. So this is how we do a two-step technique. Now the advantage of two-step technique is less tension on the sheet and reduced chances of tearing the sheet. But the point is that disadvantage is you need a chairside assistant. You need the momentary discomfort might be felt because of the patient, because of the press, because of the sheets that we are trying to press beneath the dam clamp. So that is how we do a two-step technique. Now next step is the three-step technique where we do the dam first. Now over here, I will just show you 3 pictures because it's three-step technique. First is the dam that you need to place on the tooth. Then you place the clamp with the help of a forceps, and then you place the frame, and you are done with it. After that, if you want, you can use floss, you can use dam inversion, and you can use a widget. That is up to the operator. Now with the three-step technique, the dam first, sorry, one second. It's easy to perform, especially for the anteriors, but obviously it will require chair-side assistance for someone to hold the sheet and place the frame. Now we're done with the three-step technique, dam first. We're going to talk about the clamp first. Nothing, no rocket science over here. Just place the clamp first, then the dam sheet, and then the frame. Three-step technique. And we are done. The biggest disadvantage is that the dam sheet might tear off, because what happens is if you're putting the clamp first and we are putting the dam sheet next, we need to stretch it a lot, because we want the dam sheet to go ahead and move along the bow, along the prongs, along the side of the dam, and to go towards the cervical end of the tooth. So this is where some people would avoid it. That's the disadvantage of this step. Now we're done with the rubber dam first step, two-step, three-step techniques. Now let me go ahead and talk about single tooth isolation, the advantages and disadvantages. Now the advantage of single tooth isolation is it's very easy, less time, root canal procedures can be done in a single tooth isolation. It's easy to isolate the cervical lesions when you're talking about single tooth isolation, but the disadvantage is it's restricted a little bit. Leakage control is a little more complicated. Dam inversion is difficult because the dam sheet is beneath your clamp. The orientation is a big problem for the beginners. So I would rather prefer and go ahead with the multiple tooth isolation. Now this is better. This gives you a better space orientation because you can see multiple teeth. There's unrestricted access. There's dam inversion, which is damn easy. Multiple teeth can be treated, and interproximal defects can be treated very easily. Again, few disadvantages: that time consuming, may require extra clamps or accessories like widgets and floss ties and whatnot and what all. Difficult to apply sometimes, cannot be applied if successive tooth is used as an abutment. So there are pros and cons for all the procedures that we do. Now the next is anterior tooth isolation, anterior isolation that we do. There are various types of isolation. This is one of the best isolation that I can suggest. You can use a floss tie, you can do anything. When you're talking about anterior isolation like this, you can use Teflon along the natural tooth, which we need to protect. When we are talking about just the central that we are working on, and we don't want to work on the laterals, you can isolate them again with the help of Teflon. You can avoid all those things, because in this procedure, in this picture, you can see that I'm just going to work on the composite, direct composite filling that I'm going to do over here. I don't need the cervical area. I don't need anything. So I can go ahead and do the anterior isolation like this. Just invert the dam and put clamps over there. In this procedure, if I'm working on the upper left central and the lateral incisors, I think this isolation is more than enough for me to remove the prosthesis on the lateral and go ahead and do a re-root canal or a root canal for the lateral or for the central. So these are types of isolations that you can do. Along with this, even if you have good interproximal contacts, you don't need clamps. You can use wedgets like this, and you can go ahead and talk about the anterior isolation from canine to canine, which you can see in this picture. So there are various types of isolations that you can do in the anterior zone. It becomes very easy. First of all, for the operator, because it's easy to see, easy to visualize, and easier for the patient also. It is damn easy. Now we all talk about the split dam technique. What is this split dam technique? It's nothing. It's just a modification of the dam that we put. This is how it looks. Now, how to achieve this? How to achieve this in the anterior aspect? How does the split dam technique look from the palatal aspect? It looks like this. I'll quickly tell you how to use a split dam. So how to make a split dam. So this is not something which is like a smiley face that I'm not going to tell you over here. This is the marking, and what the marking represent is these two markings are for the premolars that I've marked. Then this is the canine to canine marking that I have done. I'll go ahead and remove it. I'll cut it from canine to canine, not the premolar. I'll just punch the premolar marking and I'll cut the canine to canine marking. Once I'm done with this, I will go ahead and secure the clamp, secure the dam on one side of the premolar. Once it is secured, I will immediately put the clamp and secure it completely. After this, what I'll do is I'll stretch the rubber dam towards the other side and secure the other side with the help of a clamp. Once done with this, invert the dam from the anterior portion and you are done with your split dam. It is that easy. It is not complicated. Once you're done with the split dam technique in the anterior or in the posterior, you can use a flowable resin or opal dam or liquid dam that we all know about, and you can go ahead and block the area that you are not concerned about. So right now, if I'm talking about this, I would probably be working on the anterior or the facial aspects of the anterior tooth, where I want to go ahead and do laminate preparation, or I want to put some kind of procedure to diagnostic procedures before I go ahead with the endodontic procedures. This is the way you do a split dam technique. In the posterior one, again, the same thing. You just have to mark the holes, punch them, and cut it. Once you have cut it, you secure it with a clamp. And once you have secured and you have placed the dam, you just obliterate everything which is there on the open aspect of the split dam with the help of a liquid dam and light cure it. Now the tips and tricks that we need to know about rubber dam, and it will help you a lot, because once you start using it, you would want to know all these tips and tricks. So what are, I would share it with you. The first thing is securing the clamp. How to secure the clamp? Now securing the clamp will come, this is something where there is medical legal complication that might turn up, and you might end up, the clamp might end up breaking. So if the clamp breaks, it will break at these three junctions. So how will it break? It will break like this. If it is worked up too much, if it's a very old clamp, it might break on at this level. So it can break at any level. So what we want to do is we want to secure all the three aspects, all the three sides of the clamp. How will we do it? If we don't do it, what might happen? This might happen. It might just slip into the oral cavity and into the throat, and you might land up in a medical legal condition. So the patient might sue you. We don't want that to happen. So what is the tip over here? You need to secure the clamp. Now, these are the old methods. This is a very old picture that I want to show you, but it's worth showing it because these are different types of different ways how you can secure the clamp. I personally would prefer to secure the clamp like this. You can use a floss, you can use the Teflon, you can use anything. So right now, if the clamp breaks over here or over towards the prong area, everything will be secured. You just need to pull it the way you pull a kite, and you can secure yourself, and this can be avoided. So if you want to avoid this and don't get into a medical legal condition, better to secure it. Better be safe than sorry. Now the next step is, there's a 4-point contact. We all say that there should be a 4-point contact. Why do we say there should be a 4-point contact? Because it has to be there. Now look at this picture closely. Is there a 4-point contact over here? I don't think so. This is one point of the clamp which is not even securing you, not even touching the tooth that is being isolated. So we don't want this thing to happen. That is why we need a 4-point contact, so that the clamp is stable. And how to know this? When you know that there is 4-point contact, just press the finger on the top. Clamp is secure with the help of 4-point contact. Along with this, there is one more important thing: the placement of the clamp. How do you 4-point contact? That doesn't mean that the clamp is secure enough. I'll tell you with the help of some kind of animation which I've tried to help, which try, and I'll show you over here that this is, if we consider this as a tooth, and this is the highest contour of the tooth. So if we try to place the clamp over here, either on the highest point of the contour or above it occlusally, what might happen? The clamp might dangle and it might pop off. So this thing is a very common thing that we all encounter, and this is not something which is dam's fault or the clamp's fault. It is our fault. What we fail to recognize is that we need to use the clamp properly. We need to place the clamp beneath the highest point of contour. So what happens is it will not dangle enough. If it doesn't dangle enough, it will not pop out. This is the placement and the 4-point contact that you need to keep in mind. Now the use of floss interdentally, how to use it and why to use it. Now we use a floss interdentally to place the dam sheet inside interdentally. We want that to happen. But when we are placing it, when we are pressing the floss, inside towards the cervical end, we do not remove it in the same way. This is the wrong direction. We need to remove it from the buccal end. When you place it, secure it, remove it from the buccal end, and it will be secure. No, there is no fear that the dam will tear off, or it will come out. Now floss tie. Now I would want you all, if you can, you can get a small floss tie right now in front of you, and you can use it, or else you can see the procedure. Yesterday only I prepared a small video for you to tell you how to make a floss tie. There are two types of floss tie. One is a simple floss tie, and the other one is a complex floss tie. I will tell you how to make a simple floss tie with the help of just a video, which is hardly 1 minute. You can see it and appreciate it, and you can use it. It's very easy. It's not complicated. Just look at it. And this is the first step, and you just need to repeat it the way you did it in the first step. There's no rocket science. We are always scared of doing this because we tend to avoid it. We procrastinate. We don't go on YouTube. We don't go to our mentors. We don't go to anyone or our seniors to teach this. We avoid it. So see this, how easily that you can make it. Your floss tie is ready now. If you consider my finger to be the tooth, this is how you pull it. The minute you pull it, the floss tie will go ahead and secure the dam, and it will give you a proper isolation at the cervical level. It's very easy. And the other end of the floss tie, you can tie it on the frame. I hope it helps, because that's a tip. Now, the tips and tricks for the beginners I would give. If you are a beginner, the most important thing is the orientation. That's one of the things that I used to face when I started the rubber dam isolation. I never used to get the orientation. How should I orient my burr? How should I orient myself? Because we are used to looking at the teeth, not just in a single isolated target area, but we see it as the entire quadrant. So it is orientation, axis, and the visibility that we are concerned about. Over here, if you can see, I'm working on the 6, and I've put my clamp on the 7, and I've given it a multiple tooth isolation. I've put a widget on the first premolar, between the first premolar and the canine. So now my orientation, my axis, and visibility, everything is set. I will not make any kind of problem, any kind of mishap while I'm working on this tooth, whether I'm doing a pulse therapy, whether I'm doing an indirect restoration placement or an endotherapy. I would want you all to go ahead and do multiple tooth isolation if you want to orient yourself and get a good access and visibility. Even if you want to go ahead and talk about single tooth isolation, there is one tip that you can use, which we always are scared of. But go ahead and put a clamp on the premolar. Okay, what it will do, it will just secure the sheet. It will not let the sheet move up and down. It will secure the sheet in the anterior aspect so that you can work on the posterior tooth when you're doing and when you're talking about a single tooth isolation. So this is something which you can, no need to punch a hole, no need to go ahead and do a multiple tooth isolation. You can still go ahead and do a single tooth isolation the way it is looking in this picture. Or else you can expect your patient to have mouth opening like this, where you can sit inside and do the treatment. Now the next thing is dam inversion. Why do we want dam inversion? Why do people say that we want dam inversion? Like even if you're taking a photo or something like that, it is better to do a dam inversion. It's very easy, very simple. Now look at this picture over here on the left side. When you see that the dam is not inverted, it is facing towards the occlusal end of the tooth. Just put a composite instrument inside it and try to invert it. Once you invert it, it looks like this. See how beautiful it looks. More than that, there are advantages of doing dam inversion. What are the advantages? Is like, if you are doing a dam inversion, look on the left side, all the 3 teeth, these are not inverted. What will happen? The GCF or the salivary fluid, or if you're talking about the lower arch isolation, things can come inside, and your isolation will be compromised. It might happen. If you do a dam inversion, if you look at the pictures on the right side, if you do a dam inversion, nothing will pop out, no liquid stuff, no saliva, nothing can pop out or go ahead and move inside the oral cavity if you're doing a dam inversion. So this is the biggest advantage of dam inversion. It's not rocket science again. It is very easy to do it. It comes with practice, so you can do it. Now, this is something which is which as endodontist and as a practitioner in the general dentistry, dam over dam technique. Why do we do it, and why do we talk about dam over dam technique? Because sometimes when I'm doing a pulp vital therapy, if I'm doing something like this, if I want to place something, if I want to place biodentine, or if I want to place calcium hydroxide and give a base and then put a sandwich technique, I want that tooth to be isolated completely. But sometimes what happens is the dam sheet gets nicked off. Can you see it over here? It is not isolated. So my purpose of doing a dam isolation is hampered. If I don't want, what I can do is there are two options. I can remove the entire setup and set it up again, or I can do a dam over dam. Nothing, just take a dam sheet, punch the holes the way you had punched it for this one, and place it again. Look at this area. Your dam is secured. The lower dam which is there, which was already nicked, is still there, but there is another dam sheet which is on top of that, and it is securing your proximal area. Now I can go ahead and do a vital pulp therapy, or I can go ahead and do an endodontic therapy without compromising that I have exposed the tooth or the pulp with the saliva or with any other contamination. That is the dam over dam technique. Now Teflon, again, this is something that you can use to isolate this picture, which is I would just want you to use Teflon whenever you're working for a bonding procedure, when you're using 37% acid, phosphoric acid, and you're trying to etch the enamel and do a bonding procedure. I would not prefer that the etchant would touch the natural tooth and disrupt the enamel over there. If you don't want that to happen, Teflon is the best means to secure the natural tooth, because it's not sticky that much, and it can be removed very easily. If just there's a spray or a blow of air and it will come out. There are various means. This picture you have already seen in the previous slide, but again I'm showing this. Apart from this, you can use the Teflon in a matrix and matrix technique. Now, this is a complex technique. Don't have to go ahead. I'm just telling you how to use a Teflon in a matrix and matrix technique. When you're putting one matrix and again another matrix, to secure that matrix, you can put Teflon in between over here, if you can see this. Again, Teflon, when you know that there is an interdental problem, there is an interdental space, you can go ahead and put the Teflon, because over here, when you realize that I want to put a retraction cord, you will not be able to place a retraction cord right now, because you are secured, you have done the dam, you have placed the dam, and you are done with the isolation. But right now, what tips? This is the tip that you can use. You can put a Teflon over there for a few minutes, sorry, and then you can just remove it. Once you remove it, you can place your auto matrix or garrison matrix, whatever you are comfortable with, and you can go ahead and make the wall. Now we talk about liquid dam every time, most of the time. What is liquid dam? Liquid dam is nothing but it's just a flowable resin-based gingival barrier that you use. How to use it? There's nothing. There's nothing to it. It just wherever there is a nick, wherever there is a small leakage that you see, you can place the opal dam or a liquid dam and cure it. If you don't want to use it, I can give you other techniques. You can use the cavit. You can use the normal flowable composite resin, and you can just secure it. So you don't need to replace it. No need to go for dam into dam procedure, and you can just secure it with the help of an opal dam. It's very easy. Look at it. On the left side, there was some kind of a problem. There's some kind of a leakage over here. Don't need to panic. Even if it's a leaky procedure, you can make it leak proof with the help of opal dam. And there you go. You are done with the leak proof isolation. This is how this is the picture which you have already seen when we are doing with the split dam technique in the posterior. Obviously, we have split it, so there will be a lot of open area. Just go ahead and fill it up with opal dam and place it and cure it. Now, the use of glycerine, this is very important because initially, if you try to use glycerine on the shiny and the glossy surface, which is the surface that is going to touch the occlusal surface of the tooth, it will be very easy for you to glide into the interproximal area. It will be very easy if you're using a two-step technique where you are using a wingless clamp. You want to stretch the dam sheet and you want the dam sheet to go ahead and get it placed. So very smoothly, you can go ahead and put a glycerine, or you can put a small drop of soap, and you're done. Again, a tip. Now, how to place a matrix? Now, this is a question that we all have in our mind. That should I place the matrix and band before I put the rubber dam, or should I go ahead and put the rubber dam and then place the matrix? I'll answer that question. Before or after the dam placement? That's the question. So look at the picture on the left side. I've placed the dam, I've secured it, I've put a floss tie over here, and then I've gone ahead and placed the automatrix over here. So I would prefer this to happen, and you can see how beautifully I can place and build the wall, and then I can go ahead with the endodontic procedure or pulpidal procedure, whatever procedure that I want to go ahead. So this is very easy. You can always put if you're not comfortable with this, one thing, you cannot use type 8 or you cannot use the normal old matrix band retainers. You'll have to go ahead and use an automatrix, or you'll have to go ahead and use a garrison matrix. This is one more thing that you can use. This is how you can use a matrix, just the band and the wedge when you're doing a proximal area. This is a Paladin matrix band retainer. You can use it. So my point is, you can always put the matrix after you have secured the dam. Now, extra plastic, I had nothing. I could not give a headline to this, so I have put extra plastic stuff that is there. This will actually answer a few questions. This is a clamp which is known as soft clamp, which is from Kerr. The advantage of this clamp is you can use this clamp when you're dealing with a prosthesis. If you don't want the prosthesis margin to get hampered, if you don't want to hurt it, if you don't want the clamp shadow on the radiograph that you see, that we always see on the pictures that are posted, there's always a radiograph that will show a clamp also inside it. You can use the Kerr clamp, which is a soft clamp, which will not hamper your prosthesis margin, and it will not show a huge picture on the radiograph. So this is something which is made of plastic, and it will help you. An alternative to this is, if you don't want to buy this, this is cushy clamps. This is some kind of a cushion. That is why it is named like that. It's cushy. You can just place it on your stainless steel clamps, and you can go ahead by securing the margins of the prosthesis that you have, and there will be no problem at all. I would like to just show you how complex isolations can be done. People avoid it. People say that, oh my God, this is very difficult. I will not be able to do it. I'll not be able to secure this kind of isolation. I'll not be able to do a resorption at the cervical level. Let me tell you, it is very easy once you get the hang of it. Let me show you a few pictures that me and my brother, we have done isolations for. This is some kind of isolation and a problem that we faced. We did a matrix and matrix, used Teflon, used another matrix band inside the auto matrix, and went ahead and built the wall over here. You can see how beautiful the wall is. Now I would be happy to do an endodontic treatment, because this is a retreatment. See, this is a retreatment. I would want a good isolation during the treatment. So I don't want, and the first step is to build a wall. So we can go ahead and do it, remove everything, and then go ahead with the endodontic procedure. It's very easy. This is a procedure where a periodontist came in and did the CLP over here, and immediately CLP, once the CLP is done, there was immediate DME that was done, and after that an indirect prosthesis was given over here, which is not included over here because it's not relevant. I just want to show you that this can be done at the same appointment. When the flap is open, you can place the matrix, you can place the dam, you can get it isolated, do your procedure properly, because this you can see, it's an upper 7. It's a molar. So you want it to you want to rehabilitate in a very good way so that the patient can use it. This is again a complex procedure for isolation. I would want you to look at this. This is a 212 clamp, which is cut in half, because if we use it, it will hamper this side. So we just cut it and we are placing it. Complex isolation, but it's not impossible isolation. You can always do it. This is the cervical lesions that we know, cervical class 5 lesions that we have. If you want to replace it with composite or GIC, whatever you want, you can do it, and you can achieve the isolation properly. Going ahead, and if you want to see the cervical resorption, which we can see over here, it's again a huge and complex. We use the flap, opened up the flap, and then isolated this. Now it's very easy for me right now to remove the infected portion, use an MTA or a biodentine or composite, whatever I want to use it to replace this, rehabilitate. I don't want this tooth to be extracted because it is firm palatally. The bone is lost, I know that, but still you can go ahead. We are talking about the isolation that can be achieved. It can be achieved, and you can go ahead and do it. This is a full arch isolation. Once you are done with quadrant isolation, multiple isolation, single tooth isolation, slowly you can go ahead and do a full arch isolation. Even if you have missing tooth, you can still go ahead and secure the clamp. See over here, I've put opal dam, liquid dam over here to secure the clamp, to secure that area because the 6 is missing. And you can go ahead and do multiple tooth isolation like this. It is a little complex, but it is good and it is achievable. Talking about isolation, this is how we are isolated right now. We are doing isolation from at our end, and this is me over here working at Dr. Moez Kakiani's clinic, and we are taking utmost importance, and we are taking good care, isolating ourselves as well during the COVID time. It has taught us a lot of things, how to it has changed how to propose a girl. If you want, you can go ahead and give a Dettol. Isolation will not divide us. This was a concept which was there in the British era, where they used to say divide and rule, isolate them and then rule it. It's not going to work over here. It is something which will help us achieve things. And I would want to show you this, because things that you know and things that you can do, you should not boast about it. You should always go ahead and teach everybody, share the knowledge, and don't make fun of it. If you don't know how to isolate, go ahead and learn it. Don't make fun of other people. I hope everybody is happy with the lockdown, and I hope they have not transformed into this guy over here, which we all know is Brad Pitt. But try to avoid, stay healthy during this COVID times. This is the picture that I want to show you, because this was taken yesterday, just to tell you how Mumbai looks from the balcony from my place over here. And you can see the ceiling over here, and you can see Haji Ali on the left side. So it's a very good picture. This was taken at 7:30 yesterday. And the isolation chapter that we have written down is in Clinical Fix Prosthodontic Master Volume. That's the 2nd edition by Dr. Moez Kakiani. If you want, you can go ahead and buy this book. You'll get a lot of tips and tricks. Me and my brother, he is VSPNite. He is from VSPM. He's Dr. Tausif Nathani. He is again co-author in the chapter of isolation. We both have done it. And lastly, I would like to thank you all for patiently listening to me. And I would thank the entire team of VSPM, Dr. Shinoy ma'am, and the entire team of VSPM, actually, the PGs, the staff, non-clinical staff, everyone who has been there and has made this event a grand success. So I would thank you all. And now I end my preparation. My seminar over here. Thank you once again for listening calmly.
Thank you, Dr. Atif. And I now request Dr. Mamta Kaushik ma'am to take up the questions and questions.
Thank you, Dr. Atif. That was a very comprehensive rubber damology we went through. The whole chapter covered nicely. I think the tips and tricks were very, very useful. People should follow it, hopefully. And, you know, so anyway, we have a few questions here. Dr. Anil Kohli had asked, what is the landmark to place the frame? Actually, even when you said we prepare the punch, okay, and place the wings also, the clamp there. the frame which you had placed there seemed a little close to me. I have to do practically, and I think sir is asking the same thing. What location of landmark should we place the frame so that the clamp is placed and it is perfectly positioned?
So
Is that
I would like to tell you, yeah. I would like to tell you one thing that the landmark is something which is you can use the chin as a landmark. You can use the tip of the nose like this. And the only thing is that if you are trying to place the frame too low, it will not cover the upper lip. So if it is not covering the upper lip, you need to move it ahead. So it is very subjective and something which you can achieve later on when you're using it more frequently. Apart from that, if you want to go ahead and if you think that it's not going to help me, you can go ahead and use the O frame. It will give you a very good retraction, and it will give you proper isolation and even give space for the patient to breathe from the nose. So I hope this helps because
So basically, with the winged clamps, where we are taking the clamp and the dam together, we position the frame before placing the clamp inside.
sorry, in the first step technique, in the single step
The
technique,
first,
we keep the entire setup ready before the patient comes because we know which teeth are we gonna treat. So it's not something which is very new. So we know the teeth that we need to treat. That is when we just prepare everything, keep the clamp ready. This can only be done with the help of a wing clamp. It will become very easy for us because we don't want to hassle in front of the.
Questions.
Sorry.
हाँ बस हो गई ना 5 6 6 7 हो गए sufficient. Okay.
Sorry, I
Thank you.
can't hear you.
this is disturbance in between. Carry on.
So what I was saying that if you're trying to do a single step technique, initially I would always prefer for the beginners to use it because that is when we know that we are treating this tooth, and it's multiple isolation also can be done, and you are prepared. We just need to use the forceps and place the clamp. So it becomes very easy at that time.
Okay, thank you, Dr. Atif. There's another question by Dr. Brajesh Sutaria. He
Yeah.
says that sometimes he faces a problem while placing a rubber dam and clamp on the maxillary molars, the 6 and 7. And then he feels that the patient's mouth opening is reduced after placing the dam there.
Yeah. So
What
this
can
is
be
some,
done?
yeah. What we can do is patients tend to get really calm once they are comfortable with it. So they try to reduce the mouth opening and they try to close it. So you can always put a bite block on the other side. So that will restrict the patient from closing your mouth. And if you want, you can go ahead and place one more clamp in the anterior region. The way I told you for the beginners, you can use a clamp and place it on top of the dam sheet. You don't need to punch a hole. So that these two things that can be done so that a clear visibility and access to the upper left 6, 7, and for that matter 8. So if the patient is trying to close it, just place a bite block on the other side of the tooth.
Thank you. Dr. Priyanka is asking, what is the thickness of rubber dam that you're recommending? Light, medium, or heavy? Which one do you recommend more?
Usually, I would prefer the medium size because light sheets might tear off very easily. The medium size or the heavy size is more than enough. Sometimes it depends. It depends on the interproximal area and the distance that you have. If there is tight contact, I would always prefer a medium size. If there is a lot of space between the two teeth, that might not help. You might have to go ahead and take a sheet which is a little more heavy and which is more stable, and you will have to use a floss tie in that matter. So thickness really matters if you're trying to see whether there is interdental gap or not. But I would prefer personally, I showed it in the seminar also, thin, medium, and heavy. These are the three sheets that I would always prefer depending on the patient.
Okay. Dr. Mamta Madhavi had asked, which is the easiest way or method of placing rubber dam according to you for the beginners? I think you answered that
I've
already, right?
covered
Yeah.
it. Yeah, I've covered it. I've given a lot of tips
So
also.
he recommended that the step one where you carry the clamp and the
Yeah,
dam together.
yeah.
Dr. Sheetal is asking, what are the other alternatives for rubber dam sheet if the patient is allergic to the routine rubber dam sheet?
Non-latex. If you have if you have now the manufacturers are coming up with non-latex rubber dam sheets where the patient is allergic to rubber dam sheets. You can go ahead and you can just buy non-latex sheet. If you don't want to buy it and if you already have it, you can use a rubber dam napkin. If it will secure and protect the oral cavity and the tissues around it. It's better that way. better to buy a non-latex sheet, and they have come up with flavors also in the dam sheets. You can buy it and go and buy it, buy the mint one, or I don't know what all, but that's not a big issue. It is just the kind of sheets that you prefer. I would always prefer a non-latex nick tone sheet. I would prefer nick tone non-latex sheets, blue colored. This is what I prefer.
Dr. Atif, what about patients who are asthmatic? How do we achieve isolation there?
Yeah, asthmatic patients, if you know that the patient is asthmatic, you can always pop in holes in between the sheets so that there is proper ventilation, not just from asthmatic patients, but for people who are mouth breathers. It becomes very difficult for us to achieve isolation with the help of rubber dam, and people get claustrophobic in that way. So you just pin holes and make them realize that yes, there are holes, because in between, if you punch holes, it is not going to tear. It will not do any harm to you, because nothing will come out of it. Even if it comes out of it, it is only the movement of the tongue, which the patient might not do it, and it will be secure now.
Okay. Dr. Sheetal is asking what are the no, Dr. This I've asked you. Dr. Mehik is asking how do you do the dam inversion? Any tricks
I,
for that? Any tips
I
for
think
doing the
I
dam
showed this.
inversion?
I
I
think
think
I've
he
showed this,
covered,
but
he covered it. Yes.
yeah, I've covered it. There's one more way to do it. I mean, you just have to pull the sheet and blow air with the help of a three-way syringe. Just the air, not the. You might do it, but I don't prefer it. I use it. I use a composite instrument. Just place it and rotate it and do the dam inversion. I think I've shown it to you.
Yes. Dr. Akshita was asking would glycerine or slope affect the integrity of the dam?
Usually it doesn't. Previously, initially when we used to get the dam sheets, they were very fragile, and they were very. I mean, soap used to act as an astringent, so it used to tear it apart. You can always go ahead and use glycerine. You can go ahead and use Vaseline for that matter, and you don't have to use it too much. Only it's just a tip and trick that you can use it for quick and easy slide. So you can go ahead and use glycerine. No need to use soap if you're not comfortable with it.
Okay, the last question, Dr. Pooja Singla is asking how to isolate in the class 2 subgingival caries in the molars, distal of 6 and mesial of 7, where the subgingival caries. This is actually
Yeah.
quite a challenge for most
Yeah,
of the
it's
students.
quite a challenge. Yeah, I know, and I can understand that. For that, there is this is something which is a complex isolation technique that you have to use. You need to use the Brinkler's clamp. In addition to the clamp that you are using, you need to just press your dam sheet ahead towards the apical area, and then again place one more clamp. So there is a clamp in front and there is a clamp in behind. The behind one clamp will always hold the sheet and keep it secured. But when you're dealing with a DME situation, when you're dealing with a very deep area situation, you can always go ahead and press the clamp apically with the help of a floss, and then immediately place a Brinkler's clamp. There's a set of this instrument, clamp, different, small, compact, but will serve the purpose.
Okay. Thank you, Dr. Atif. I think that
Thank you so
covers
much.
a lot of rubber dam, and we hope to see all students practicing a lot of rubber dam also
I
along
hope
with
so.
this.
I hope so.
Very comprehensively, very nicely covered the entire
Thank
topic.
you. Thank you so much.
Dr. Varsha?
Yes. Thank you, Mamta ma'am. Thank you, Dr. Atif, for the wonderful session and for your clinical tips and for being a part of the E-Link Fest 2020. Now, on behalf of our Department of Conservative and Endodontics, we would like to give a certificate of appreciation to our speaker, Dr. Atif, and a certificate of appreciation to our moderator, Dr. Mamta Kaushik. Thank you. We would like a few more minutes of your time. We have also arranged Mask It, a selfie with mask contest. So we request all of you to participate in this contest and send innovative selfies with their masks on or before 29th of July. The date has been extended on popular demand. The details are displayed on the slide. I would now like to take this opportunity to highlight those individuals in our specialty who have enriched their lives with activities other than academic and clinical practice. I would like to introduce our endo star for today, Dr. Suparna Ganguly Saha, a graduate from R. Ahmed Dental College, Kolkata, and postgraduate from Bapuji Dental College, Davangere. She has a teaching and practicing career spanning 20 years. Currently, she is the president of IDA and working as a professor and head of department, College of Dental Science, Indore. She has presented scientific papers in national and international conferences with multiple publications in various international journals. She is a faculty with the Art of Living Foundation and is a life coach contributing to improving the mental health of hundreds of people. Her passions are spirituality and music. A social worker, she regularly takes up projects for social welfare. Let us have a look at this video clip showcasing her non-academic talent.
एक प्यार का नगमा है, मौजों की रवानी है, जिंदगी और कुछ भी नहीं, तेरी मेरी कहानी है, एक प्यार का नगमा है। कुछ पाकर खोना है, कुछ खोकर पाना है, जीवन का मतलब तो आना और जाना है, दो पल के जीवन से एक उम्र चुरानी है, जिंदगी और कुछ भी नहीं, तेरी मेरी कहानी है, एक प्यार का नगमा है।
We are very proud of Suparna Ganguly Saha ma'am. With this, we have come to the end of our session, and I would like to call upon Dr. Mohit Gunwal to propose the vote of thanks.
On behalf of our Department of Conservative Dentistry and Endodontics, VSPM's Dental College and Research Center, Nagpur, I would like to express my heartfelt gratitude to our eminent speaker for today, Dr. Atif Nathani, for sharing his expertise on the rubber dam isolation. I would also like to extend my heartfelt gratitude to our chairperson for today, Dr. Mamta Kaushik ma'am, for sparing her valuable time with us. Thank you to all senior faculty members and participants for joining us today. See you tomorrow, same time, 11 a.m. with another informative topic on Facebook Live, Endocons VSPM Nagpur. With this, I would like to conclude the today's session. Have a great day ahead. Thank you.